It's time for Talk on the Tee. Here's Johnny Chauvin.
Talk on the Tee, Part 1, being brought to you by Douglas Kent Jewelers. Fine jewelry, beautiful watches, baby jewelry, gift items, and on-site jewelry repair. Since 1985, it's Douglas Kent Jewelers, located in the West Side Plaza on Thomas Street in Hammond. Time now for our North Oaks Health Notes. And, of course, we're here talking to Lisa Goings, who's North Oaks Hospice Director. We'll talk about hospice care during our segment this morning. Being diagnosed with an incurable illness can be overwhelming and terrifying, too. And joining us today to discuss a special type of health care that can help make the end of life as meaningful and precious as the beginning is North Oaks Hospice Director, Lisa Goings. Good morning, Lisa. Welcome back.
Good morning, Johnny. How are you?
Just fine. We want to keep people reminded about hospice care and how important it is for the families.
Absolutely. Hospice care is extremely important, and it is a special kind of care that we're able to provide patients and their families at the end of life. And it's about affirming life. It's about how they want to live their life to the very end, and how do they want to spend their days. It's that quality we want to be able to help them to manage as they go through just one of the most vulnerable times in their lives.
Yeah.
And can be scary at times
and
as
it's
well.
celebrating their life.
Absolutely.
Too, at
and
the same time.
That is one thing that we do as a staff is we celebrate their life. We love with them, we cry with them, we laugh with them, but it's mostly what do they want to do? What do they want to achieve? What are their goals for that day? And how they want to live.
And it's so important to them that even in the obituaries, if I could bring that up, they even mentioned North Oaks Hospice Care. We'd like to thank them for the care, yes, and because they develop a family relationship, like a kind of a new family relationship, yes, or an additional family relationship.
It is. Once they come into our hospice program, they become part of our family. And we become very close to the families as well. And we help them to achieve what they want to do and what the families want to do. We recently had a patient, and horses were a big thing in his life. And we were able to, with the help of our social worker and our team, bring a horse into his home. So it's not
Wait a minute. Like a real horse?
A real horse. And we brought it into his home.
Wow.
And so we were able to bring that and bring joy to his family and to him.
Sure.
And it was just that special moment where we can help them to achieve what they want. And like I said, it is about living and what do they want to do.
Right.
And how they want to live.
Reminds me of my dad, who went through hospice care, too, back in 2004. And he wanted to go by the pool again.
Yes.
And we brought him out to the pool and smiling at me, and just brings up a whole different, like a rejuvenation, if you will.
And it does. And it's, it's our whole team working together. It's our nurses, our social worker, our chaplain, our medical director, our nursing assistants, and we work together so that we can bring things to them if they're not able to go out and do things. So we help facilitate that.
Right.
And we've helped patients who've wanted to visit families out of state. We help facilitate those trips so that they can do as part of their last wishes.
For sure.
So
what types of conditions are treated by hospice care?
The types of conditions that we commonly see: cancer, end-stage organ failures such as congestive heart failures, liver failure, kidney failure, lung failure, those type of conditions. So we look at that, and the patient has to be deemed with a prognosis of 6 months or less to live. And that can be terrifying as a patient and the family receiving that.
Sure.
So that's where we go in and we speak with them, and we provide lots of education so that we can be with them through this process. So this process is smoother and it's an easier transition. It's never easy talking about end of life, and people kind of, shudder up about that,
right,
and get scared. But we're there to help provide what is expected and what's anticipated.
And can be as early as 6 months.
Early as 6 months, we help to form those relationships, get those resources in the home, provide that education, resources including medications, those medications that might be needed for pain management, because we want to focus on pain management and comfort and quality. We treat the symptoms. We also provide the equipment into the home, as well as any supplies that are needed.
So who comprises that team?
It is comprised of our medical director, which is Dr. Steve Godin, and also, too, our co-medical director, who is Dr. Pelche. We also have our nurses, our registered nurses, nursing assistants, chaplain, social worker, our program assistant, and our volunteers.
It's a big team.
It is absolutely a big team. And we work together every day and communicate about our patients, and that's the key, is the communication we provide to them.
And they all have different jobs.
They all have different jobs.
Timing.
Different timing. We see our patients. The frequency of visits is based on what the patients need. So if there's a lot of education that needs to take place, maybe the nurse needs to see them daily. Or if the nursing assistant, they may say, hey, I don't want, only need nursing assistants to come out 2 or 3 times a week, then we adjust to what they need. And those frequencies can change. And the nurse is available 24 hours a day, 7 days a week. So she's on call all 24 hours.
So how do we encourage earlier referrals to hospice care?
Discussing, and I think, and talking about what their goals are, especially with patients who have end-stage diseases, is discussing that what their goals, what do they want to achieve, and what do they want their life to look like, and what do they want their days to look like, and that's bringing up those discussions with their physicians and with their family. So it's sometimes difficult for a family to accept, and it's sometimes difficult for the patient to accept, and everybody's different. So it's having those open discussions.
All right, so who should we wait for a physician to say it's time, or is the family saying it's time, or do they know?
It could be both. The physician may say it's time, but it may not be the time or of acceptance for the patient at that time, and they have to be comfortable with that decision. And then other times it's the patient brings it forth and their family, and they feel it's time for them, that this is the route I'd like to go. This is what I would like to do to achieve my goals, and this is what I would like to do.
So they think it's time for you to come in.
Correct.
But what if the patient who shows signs of recovery, can they be returned to regular medical treatment?
Absolutely, absolutely. I commonly laugh because one of my grandmothers was on hospice 3 times, and the first 2 times she improved, and so she
say, "See, I told you." Or
yes, exactly. So the first 2 times she improved, and so she graduated out of hospice, and we do see that. We see patients who graduate out of hospice, and there have been studies that have shown that patients who actually choose the hospice route versus the curative route actually live longer.
And this is like caring for a dying loved one. This is at home.
Correct.
Right?
It could be in the home. It could be in a nursing home setting. It could be an assisted living setting. It could be in any of those type settings, that relatives' home, wherever they would like to be.
All right. And going back to the time when Dad was going through hospice, they were talking about the pain that he was in at different times. So how does hospice manage that pain?
Our nurses, we assess the pain level of the patient, and we do a comprehensive pain assessment for the patient, and then we discuss what is best for the patient. And we look at the interventions. We discuss it also, too, with our hospice director. And so as a team, we discuss their pain management and place those interventions in place so that they can best meet their pain goals and their pain needs. And it could be through medications. It could be through relaxation techniques or non-pharmacological measures. So we get the patient on board and ask them what their goal is, and that's how we help manage that pain.
So does hospice, some people may think that hospice may make death come sooner.
No, we do not. We don't hasten death. We don't slow it down. We allow the natural progression of the disease and the dying process to take place. So there's nothing that we speed it up and nothing that we slow it down.
Everything happens naturally.
Happens naturally.
You just try to take care of the pain and give them comfort during
Correct.
that time.
We take care of those symptoms that the patient is dealing with at that time, whether it's pain or any other things that they're dealing with.
Now, is hospice care covered by insurance?
Most insurances cover hospice, and the Medicare has a hospice benefit, and it covers hospice.
And is it available to the uninsured?
Yes, it is available to the uninsured. Most hospices, and there are foundations, too, that patients can go through as far as getting help to get hospice care.
And any help to the family after the person passes away?
Once a loved one passes away, we have our bereavement program, and we take care of our families for 13 months after the loved one has passed away. Yes, whether it's through communication, whether it's through letters that we send, because everybody is different regarding in their way they deal with grief. So some people may be further along or more accepting, and some others may be having a difficult time. And that's where we have our social worker and our chaplain step in to help with them, to guide them through their grief and through that process.
All right. So y'all set up like grief support groups and stuff like that?
Yes, we have our grief support group, which is led by our hospice social worker. And that is where it is open to any adult in the community, regardless if their loved one has been on hospice or not. So it's anybody within the community who may be going through, could be a traumatic death of a loved one. So they meet in our hospice office twice a month.
On the North Oaks campus?
Worker. Yes, on the North Oaks campus.
All right. And you got some upcoming meetings?
Yes, June 20th from 1 to 2 p.m. and July 6th from 1 to 2 p.m. And July 18th, we have 2 time out options, 1 to 2 and from 5 to 6. And anytime they can call our hospice office to get information, we'll be happy to provide it for them.
Now, is this for people who've had someone pass away in hospice care?
In hospice?
Or is it somebody who wants to find out about hospice care that they know that they may have to go through that with a family member in the future?
If they've had a loved one that has passed away in hospice care or who have passed away in general, they can call our office to get support group information. And if they would like to get information about hospice care, it's no obligation. They can call our office. We'll be happy to set up a time. They can come in our office to meet. We can go meet them in their home, or we can even speak with them over the telephone, whatever makes them more comfortable.
Okay. And I see you have cancer support groups too.
Yes,
huh?
We do have our cancer support group. It's led by our social worker. And it's providing emotional support to our patients and families, and they have an opportunity to join other individuals facing similar circumstances and helping to get them to interact and help them through this process of cancer.
And you have some upcoming dates for that as well?
Yes, June 14th and 28th from 1 to 2 p.m. and July 12th and July 26th from 1 to 2 p.m. And anybody can call North Oaks Oncology and Hematology for more information regarding the cancer support group.
All right. I see you have some other support groups here,
we
too.
had plenty.
Caregiver,
Absolutely.
Stroke support groups, traumatic brain injury and spinal cord injury support groups.
Yes. Our caregiver support group upcoming dates are July 5th from 1 to 2 and July 19th from 1 to 2. It, again, is inviting caregivers of loved ones or friends that may be taking care of patients who are ill. And it's to help them because it can be very lonely and isolating as a caregiver. And it's just overwhelming. So it is led by a social worker. So they will be able to meet together, and anyone can call North Oaks Hematology and Oncology regarding for more information. And then we have our stroke support group, which meets July 5th from 12 to 1, and our traumatic brain injury and spinal cord injury, which meets July 7th from 12 to 1. And these are led by a physical therapist and an occupational therapist. So it's helping those who have been through strokes and stroke survivors and their caregivers, and also to support socialization and education for survivors of traumatic brain injury and spinal cord injury.
All very important stuff. All right, so how does one contact you for more information or maybe a consultation?
You can call at 985-230-7620. That is to our office, and speak with our program assistant or one of us that, and just we can provide that information and set up an appointment to meet with you.
Easy as that. All right, 985-230-7620.
Yes.
All right. Thank you, Lisa. Thanks for coming in. Always interesting. North Oaks Hospice Director Lisa Goings, our guest this morning on North Oaks Health Notes. Thank you, Lisa. See you next time.